It's subject to change, but we will not be using all of the class time allotted. And so here is the schedule. The days highlighted in green are the days we'll actually meet in person. You will have 2 assessments. We're going to talk about that a little bit later on, what is required for those. But one of them is going to be due during a long break we have in class. So make sure you guys set alarm clocks or do what you need to do to submit that on time. This schedule is also found on Canvas. It's the first slide deck on the research evaluation page. And then there's a second assessment due on a day that we're actually supposed to meet, but we're not gonna meet. I wanna give you guys that time to complete the assessment, and then we'll end a few lectures early, so the remaining time will be used for your capstone research. If the schedule needs to change, I will be working with your class leader and she'll let you know as soon as possible. But for me, I want it to change only to benefit you guys and your studying for other exams. So that's my goal, is to give you as much time to study as possible. So, all right, so in this course, yes. So,
Publish this test yet, have you?
yes.
I don't have it.
It's not on.
Like, we don't have that class on icon.
Is it in research eval?
Yeah,
That's
I don't have research on it.
It's in there.
I got you. I see now.
You got it. Okay. No problem. That's fine. It's okay. All right. So in this course, we're going to I'm going to introduce some of the methodology, some of the statistics, and some of the historical aspects of conducting medical research. All of this information will hopefully just give you some background on research, why it's conducted, how it's conducted, but ultimately it should help you complete, of course, your assessment requirements for this class. But I also hope that the information helps you with your capstone project, because you're going to be evaluating research for your capstone project in terms of looking at articles and assessing the article's validity based on your particular question. So that's the goal of this class. So anything that we talk about in here is not for you guys to memorize, and it's not for you guys. These slide decks are resources for you guys to use. And also, by the way, when you guys are clinicians, you're going to be doing this throughout your entire career. As new standards of care, as new protocols of care are developed, or if you have a unique case, depending on what type of clinic you work in, or if you specialize, you will need to look at the research to find the best or better ways to treat your patient. So that's what the goal of this class is, just introducing you how to look at research, what to look for to determine whether or not it's relevant to your practice and even to the medical field in general. So can somebody tell me what is research? Anybody? Now, all of y'all, there was a lot of folks that raised their hand. Now you're trying to act like you don't know what research is.
Deeper into a topic.
Looking deeper, perfect. Looking deeper into a topic in a scholarly fashion, absolutely, correct. So research is a structured curiosity that reduces uncertainty. We conduct research in the medical field. The ultimate goal is to treat patients, even if you're not doing actual clinical research. And I'm gonna talk about an example of a research that I did that ultimately led to patient care and particularly warfighters. So correct, research, we conduct research because we want to answer a specific question about a condition, and we care about it because ultimately we want to make sure we have the best and most effective way to treat patients. And so the sharper the research question, the cleaner the design, and the better the results, the more applicable to patient care. And so we're going to talk about a couple of different examples of types of research. And when you guys do your assessment, we're going to talk about some of the research that was conducted in the assessments that you guys are required to do. So here is medical research. It's broadly divided into 3 different groups. You have laboratory-based, clinical, and population studies. For the latter 2, there are interventional and observational arms, meaning interventional research is where the researcher actually changes a variable, it manipulates a variable. So for the case of clinical research, one of the easiest things to think about is we're giving a drug to treat a condition. But also it could be introducing a diet regimen or another protocol, like a new methodology, physical therapy versus some other different type of therapies to treat patient conditions. That would be interventional. And observational, as you're just looking, the researcher, there's no manipulation of the variables. The researcher is just watching what happens over a period of time. And we're going to talk about many different examples. We're going to go into detail about the different types and when we get to the research methodology lecture. But here are the different types of examples. For the basic laboratory, this is what I have done in my career, and it's applied, meaning it's experimental. So you have different ways you can do that. You can look in cell cultures, or you can use animal models. When you start using animals, that's considered preclinical. And then within those subfields, you can do a number of techniques or applications, including biochemical applications or molecular biological applications where you're looking at protein expression, or even physiology where you're looking at protein function. And I've done a couple of different methods where I used mutagenesis and mutations of proteins to answer certain questions. Then you have theoretical research. That's where you have an idea, you come up with an idea based on what's already been published in the literature. And for example, you can come up with an idea about how you think a certain nerve is mapped from the heart to the brain. So based on studies that relate to that topic, you will come up with an idea of how you think it works and develop a model, and then you will test out that model doing actual experimentation, and you'll probably start with an animal model. And so for clinical research, clinical medical research, clinical trials, that is the gold standard of research, of interventional research, and that is what we use to get drugs and products approved through the Food and Drug Administration. And I'm going to talk about the different phases. There are 4 phases of clinical trials. And here are just some of brief definitions of all of the medical types of research that I discussed on the previous slide. And I'm going to go into a little bit more detail about the specific arms of the research that we've talked about. So for laboratory sciences, again, I mentioned what theoretical is. You're not testing anything out. You're coming up with a proposed method or model of what you think might be happening in the brain, for example, and then you're going to test that out and see what your theoretical model, how it lines up with the actual experimentation. Then you have the preclinical studies, which include all of these different applications that I talked about. Pharmacology, you're testing a drug. Microbiology, you might be testing microbial resistance or something like that. And so I'm going to briefly go over one of the studies that I did in my first assignment in the Army. I worked at Walter Reed Army Institute of Research, where we conducted research on traumatic brain injury. We had 2 models of traumatic, well, 3 models, but in this study, I looked at 2 different animal models of traumatic brain injury. My group studied my group was looking for biomarkers of injury, meaning anything that changes in the body that can be used to predict injury and injury severity. So previous researchers in my group looked at proteins, and I looked at small RNAs. These small RNAs, called microRNAs, about 22 nucleotides long. They are hairpin loops, so they're very stable even outside of the body. And so the idea or the theory that we had is that these microRNAs would, after injury, leak into the cerebral spinal fluid and even into the blood, and they could be detected in the blood. And so my project looked at the severe TBI model and a concussive TBI model, looked at changes of microRNAs for a time course. I did 4 hours, 1 day, 3 day, 7 day, and some microRNAs I also went out to 14 days. And so here are the 2 models of TBI. So the mild model, it simulates getting hit in the head with a helmet on. So you see the rodent has a helmet. We didn't notice any gross morphological differences in the brain for this mild model, but the severe model simulated getting shot in the head. And so there was a probe inserted and a balloon inflated. And of course that caused a number of different types of brain injury, behavioral deficits as measured by the behavioral assays that are conducted in animals. And so I looked at these 2 models. I wanted to find out, did microRNAs change in the brain and the blood? I also looked at the CSF, but I'm just going to show a couple of examples of how it changed in the blood and the brain. And so the experimental approach that we use is called pathway analysis. And so this is a bioinformatic technique that basically it's kind of exploited from cancer research. So this model or mathematical model, they've taken a number of proteins, genes, RNAs, microRNAs, all of the elements in particular pathways, and they've entered them into a system. And then for the different cancers, they're looking at how these molecules are altered, what regulates what. So microRNAs are responsible for regulating gene expression. So one microRNA can regulate gene expression for hundreds of genes. So this methodology was basically telling us what is going on in the brain after traumatic brain injury based on what we know about the particular microRNAs and the particular proteins that are implicated and have already been entered into this informatic system. So what we found after severe traumatic brain injury in brain tissue, we found over 60 microRNAs changed for all of the time course tested, both upregulated and downregulated. And this is just showing the overlap of changes. We found multiple microRNAs changed at more than one time point, in particular, the ones bolded, MIR21 and MIR223. Those microRNAs are implicated in cytokine production, as we know that's involved in inflammation. And so this was very promising results, as one of my colleagues had shown in a previous study that I'm not including here, that cytokine levels, in particular IL-6, was greatly increased after traumatic brain injury. So then I looked to see if there were any changes in the blood of severe TBI. And I found several changes, not as many as in the brain tissue, but this is just demonstrating that the changes in the brain are actually leaking into the blood. And so this is where we kind of focused our attention, because this is what will allow us to use the blood as the source of determining what the changes we saw are and whether or not they can be used as diagnosis of a traumatic brain injury. So then I'm only showing the blood for the mild TBI model, but we also did the brain as well. And there were far less microRNAs changed as we expected, but we do see changes up to 3 days. Most of the changes were an increase in microRNAs. So of particular interest, we found one microRNA, miR-150, to be changed in both the blood and the brain tissue after severe traumatic brain injury. And so what I did from this point when I found this, I looked into the literature and I found a study done where a group of scientists studying TBI in human patients found this same microRNA to be changed, and there were decreased in neutrophils of actual TBI patients. So I was like, yes, something worked. If you guys have done research, you know, a lot of times stuff doesn't work. You don't know when you're gonna graduate. People ask you, I'm getting PTSD now thinking about it because I didn't know. I got tired of people asking me, but I had already graduated by then because I was in the Army, but it was very nice to have something work. And the changes that I saw in my preclinical studies had actually been shown in a clinical research. And so, of course, I left this lab shortly after this, and they've continued on looking at different protein markers of traumatic brain injury and other markers of injury. But why is this important? Why do we care about this? Well, we care about this because this research project and everything that my group did at Walter Reed Army Institute of Research is designed for the warfighter. And so in 2021, the ISTAT Alinity Traumatic Brain Injury Plasma Assay was released and able to be used, fielded, and it's now being used in combat settings. And what this device does is it detects changes in proteins that indicate traumatic brain injury. And so what this allows us to do as warfighters, and you guys will be like for real on the front lines of this stuff as we shift into different forms of combat. If one of your patients experience a TBI, this analyzer, which can be used in non-sterile conditions, it can give results in 15 minutes, will let you know how to triage your patients. Meaning, do they need to get further treatment? Do they need to step out of the fight and get further treatment? Or can they jump back in and continue to fight? So that's the purpose of this type of research project, and it's going to be what you guys are going to be doing in your practice. Are there any questions so far? Does that make sense, what I said? Yes? Okay. All right, good. So in terms of the clinical research arm, again, I talked about the interventional and observational. Observational, there are prospective and retrospective studies. So prospective, again, observational, no intervention, no manipulation of variables by the researcher. What happens is you just watch, a research group will watch a patient that is exposed to, for example, an agent that might cause cancer. Like, are they exposed to secondhand smoke? You'll watch them over a 10-year period, or do they smoke? You'll watch them over a 10-year period to see from that group who developed cancer and had the risk and who didn't develop cancer. And then you look at different metrics in the body to see what changed. And that's an example of an observational study. Now, for the experimental or the interventional studies, that's where the FDA clinical trials comes in. So what happens is the FDA clinical trials is a very rigorous and stringent process that can take up to 15 years for a drug to get approved. So if you take the project that I did, that would be preclinical, basically we would have to do that on a larger scale. We would increase the size of the animal. So we started out in rodents, we would go all the way up to primates. And that was what was done to actually get this Alinity device fielded. They had to start with rodents and they found promising results and they went all the way up to primates. So in the preclinical process, the data is collected. If the data is good, meaning you're finding good metrics. If you're giving a drug, let's use the example of giving a drug, because that's probably more likely what will happen. So if you're developing a drug, you'll test it in a small animal, move to primate if the drug is shown to be effective, meaning that it's reducing or improving whatever conditions you're studying. Also, you're looking at parameters of, is the drug toxic to organs in the body for those primates or whatever animal models you're using. If all of that data is good, then the drug will be, application will be submitted for the FDA and the drug will be entered into phase 1 of clinical trials. So, if you start with 100 drugs in the preclinical phase, only about 32 drugs will make it into phase 1, meaning the other drugs just didn't produce data good enough. It might have been toxic. It wasn't showing a big enough difference in the effect, or it might have been just as good as the standard treatments that are out there already. So phase 1 is asking the question, is the drug safe and how does the body handle the drug? So we're looking at a healthy population of up to 100 people. We're looking at, is the drug safe, meaning that does it affect organ systems? Is it causing unexpected illnesses or sicknesses? That's what we look at. If those results are found to be good, then of the 30 drugs that made it to phase 1, about 20 will make it to phase 2. And again, phase 2 is looking at the diseased patients. So whatever the particular disease is, we're looking at side effects. And again, we're looking at efficacy of the drug. Is it working as we expect it to work? And also, are we seeing any unusual effects of the drug? And so this process can take up to several months or up to 2 years, really, looking into phase 2. So we have 20 drugs that made it to phase 2. A third of those drugs will make it to phase 3, about 30%. In phase 3, again, we're testing diseased patients, about a couple of thousand patients. We're looking for efficacy. We're looking for pharmacokinetics, meaning is the drug entering the body and being removed from the body as we suspect it to be. And we're also looking for adverse effects. Does anybody know what adverse effects is? Say again. Negative side effects, right, negative side effects. So we expect drugs to have side effects, like we expect nausea because it's going in our GI tract, but you don't necessarily expect like liver damage or kidney damage. So that would be an example of an adverse effect. It's something that you don't necessarily expect the drug to cause. And so from this point, there are about 6 drugs that have made it to this point from the 100 in the preclinical phase. So 4 of those drugs would get approved at this point and a new drug application would be submitted to the FDA. These drugs would get approved and they wouldn't even need to go to phase 4. But the remaining 2 out of the 6 might need to go to phase 4. And here's where the drug is tested on a large-scale population and it still continue to be monitored post-market of the drug. You still want to make sure that it's safe and effective. And again, this process can take up to 15 years for a drug in the preclinical phase to get approved in phase 4. Some will get approved in phase 3. Those that got approved in phase 3, they're approved without any conditions, meaning they're ready to be sold on the market. And so this would include several hundreds of thousands of patients. They want as many patients or many people as possible because that will help the data and that will confirm the data that they're already getting thus far on a larger scale. Are there any questions? Yes.
What happens if the disease or condition is something extremely rare because they have to test it on thousands of volunteers that have the condition? What happens if they don't have thousands of
That's a very good question. They're going to try to get as many people as they can. That's a very good question. So they will, if there's not thousands or hundreds of thousands of people that have a condition, then they will try to test it on as many people that they can. And they might even look at some conditions that are related, if there are some. Very good question. So this slide is out of order. I apologize. This should be what I wanted to go to next. You guys have the slide in there, right? Off-labeling. Okay, so off-labeling. So once a drug is approved from the FDA, it's approved for whatever use it was studied for. And so, but as providers, you guys will be able to give a patient a drug that was approved for one condition for another condition. And that's going to be based on the symptoms the patient has and based on your medical expertise and if you think it might benefit the patient. And there's no approval needed for that for you guys as licensed clinical professionals. You won't need to get any type of approval. You're using your best judgment as for your patient care, because the goal is patient care. However, if a company wants to use a drug for a purpose that it wasn't originally intended, they have to submit the drug back through the FDA. And an example of this is Ozempic. So we know Ozempic was used for diabetes. We saw significant weight loss. And so then the company had to market or wanted to market it for weight loss, and they changed the name to Wegovy. They increased the dosage of that, and they had to do more studies. This process was significantly expedited because it was the same drug and it was just an increased dose. So whereas the process would have taken 15 years, because so much was known about Ozempic, Wegovy, it only took them like 3 to 4 years to get approved because they had so much information already about the effects of the drug, like is it like the side effects, the efficacy, and all that. So it was significantly expedited. And so as providers, of course, you guys would ask these types of questions if you want to consider using a drug for off-label purposes. And it's very common for providers to give a drug for an off-label purpose when they have evidence that it's beneficial for something else. All right. And so for the population studies, again, observational, you're just looking at what happens. And we're going to talk more about the specific types in detail when we get to the methodology lecture. But for the interventional, one seminal study was introducing fluoride to drinking water to decrease cavities. That was done in Michigan in the 1940s and 50s, and they found they did this over a 10-year period, and they found a 50 to 60% reduction in cavities by adding fluoride to the water. And that's why fluoride is still given now. I had my teeth cleaned yesterday and they put a whole bunch of fluoride on it. So still do that. That was one of the first major studies done on the population scale that looked at an actual intervention and found significant results that is still, used today. So any questions about the different types of medical research. So all of the medical research falls under evidence-based practice, even the preclinical phase. And what that means is that we are taking information based on published work. We are assessing how valid that published work is. And as clinicians, you guys will be introduced to patients that have a unique condition and you want to figure out how to treat them. So you're going to take your expertise, you're going to take what's known out there in the literature after you've evaluated it. You're also going to consider your capabilities and the type of clinic that you're in, and then what the patient wants. All of those variables are going to be input to come up with the clinical decision. And of course, that is going to impact your overall patient care and patient management. So, for example, if you have a 70-year-old male patient that is having back issues but does not want surgery, you might look in the literature for what are some alternatives, physical therapy or some other types of therapies. And then because this patient doesn't want surgery, you will find different types of physical therapies that may benefit the patient, and you will start with that as the treatment plan for your patient because they don't want surgery. Any questions about that? So when you need to consider your clinical circumstances and settings, one example of that is like you have to work within your lane, I guess, your parameters and what resources you have. So if you have a patient with severe asthma, but you don't have a pulmonologist, then you might want to refer the patient out to some place that has a pulmonologist that can actually do what needs to be done to find the best treatment for that patient. So in evidence-based practice, there are 5 steps. This is what you guys will be doing for your PICO project, your capstone project. And so it starts with 1, you're assessing the problem. Once you assess the problem, you're going to ask the medical question based on PICO. I've been using PICO, but you guys have already gone over that, right? Okay, good. Yes. You will ask the question based on the PICO elements. Then you will do your literature review search in all the databases and inquire all of the studies that are related to your question. You will assess that data based on a number of variables that we're going to discuss later on in this course. If you find the data to be valid, then you will apply, and the assessment is the appraisal. You will apply that valid data ultimately to your patient treatment plan to ensure that your patient has the best care that you are able to provide. All right? And here are those 5 steps that I mentioned. So you guys are familiar with PICO, and here's an example. An adult with hypertension does a low sodium diet compared to a standard diet reduce blood pressure. This is a standard PICO clinical type question. Some other things you would consider is the type of questions you ask. So there are 5 different types of clinical questions. So what treatment works best would be therapy. How accurate is the test might be what you're looking at for a diagnostic test. This is all depending on what type of PICO questions you guys are asking. And then some other ones looking at, are there ways to prevent a certain condition? Are there ways to reduce the factors that are associated with, say, developing cancer? Just depending on the type of questions that you ask will tell you the type of studies you need to look for when you're doing your literature searches. So if you're looking at a drug therapy study, you would select randomized clinical trials as they are the gold standard for interventional studies. Also, you would use systematic review and meta-analysis research because those are very stringent and standardized, and they are very inclusive of a bunch of subjects and a bunch of studies, sometimes across the globe. If you're looking at a diagnostic study, you also look at those same type of articles. And then if you're looking at a prevention study, you would use a cohort study. And we're going to talk about cohort study and case control studies in the fourth lecture of this course. But as I mentioned about the systematic review and the meta-analyses, also very important when you guys are assessing your articles is the number of subjects. So if you have a small number, that can't be applied to the general population. So the larger the number of subjects, the more diverse the population of subjects, the more applicable to the real world, because that's how we are in the real world. We're diverse, there's a lot of us, so you want to get the studies with the largest number of N, and that will help support whatever the findings are for that particular study. And of course, that will lead to the specific statistics used in the study. We're going to talk about that in the next lecture. Are there any questions? So what I want you guys to do, this is your assignment, it's a little threat. Just read the next couple of slides. We're going to go over this, not the next lecture, but probably the subsequent. So there's this slide basically is one way on how to prepare and present for Journal Club. I believe you guys are going to have to do this in phase 2 in some form or fashion, but the criteria in these 10 steps are the criteria I'm going to use to help you guys assess the 2 articles that you will have to complete, or the 2 assignments you will have to complete in this class. So I've highlighted some of the information in the 10 steps on the subsequent slides. We'll talk about all of that, and I'm going to give you 2 examples of articles that I've assessed to give you like a template on what to follow. And in the next lecture, we're going to be talking about some of the common statistics you guys will be seeing maybe in the articles that you select. And then we're going to talk about the research methodology and why there are many controls placed over research in terms of federal regulation. So are there any questions about what the purpose of this course is? So somebody tell me what the purpose of this course is, please. Learn how to research, yes, definitely, thank you. Learn how to research, learn how to evaluate research, because again, you guys will have to do that for this course, you will have to do that for your capstone project, and ultimately you will have to do it as clinicians. You always want to find the best way to treat your patient. So, are there any questions? All right, I will see you guys next week.